Hey there, viewers. It's safe to say that most of us have forgotten a familiar name or place. Sometimes the right word simply slips our minds. For most, this is just a temporary mind block. But for those dealing with dementia, familiar places, faces, and activities become hard to remember. In today's video, let's focus on the general term for memory loss, dementia. Let's discuss what is dementia, the different types of dementia, and the early dementia signs and symptoms. Number 1. Memory loss of daily life. As we've mentioned, the medical term dementia is a general term that describes memory loss and the inability to complete daily tasks. Dementia itself is not a specific disease or disorder. Rather, it encompasses certain medical conditions and disorders such as Alzheimer's disease, vascular dementia, and Lewy body dementia. But before we get to the different types of dementia, let's quickly discuss what causes dementia and the most common early dementia signs and symptoms. Dementia occurs when there is damage to those brain cells that are responsible for different normal functions. This may include memory, judgment, orientation, and even movement. When these brain cells are injured and cannot communicate, that's when early signs of dementia appear. As for what causes brain injury, the causes differ based on the types of dementia. Advanced age, family history, and traumatic brain injury may all be risk factors for dementia. The most common symptom of dementia is memory loss of recent events. Instead of forgetting events that occurred 10 or even 20 years ago, dementia patients have trouble remembering what happened earlier that day. This memory loss may manifest as forgetting family members' names, misplacing objects, or getting lost in familiar places. Number 2. Inability to complete daily tasks. Alzheimer's disease, Lewy body dementia, and vascular dementia are the most common types of dementia. Alzheimer's disease, which accounts for around 70% of cases of dementia, is a progressive neurological disorder that affects people over the age of 60. Along with specific risk factors such as genetics and environment, Alzheimer's disease is caused by neuron loss. This type of brain injury is the result of neurotoxic plaques and proteins that cluster together and disrupt brain cell-to-cell communication. The more advanced the Alzheimer's disease, the more evident the symptoms are. Along with memory loss, dementia may manifest as the inability to complete daily tasks. Have you ever forgotten to add spices to your favorite dish? Well, people with dementia may have trouble preparing the entire meal. Creating grocery lists, dressing according to the weather, and paying monthly bills can become impossible tasks for those dealing with dementia. Number 3. Language problems. Did you know that early onset dementia may also cause problems with language? Vascular dementia is another type of dementia that may cause similar inabilities. Not as common as Alzheimer's, vascular dementia accounts for around 5 to 10% of all dementia cases. Vascular dementia occurs when there is a blood flow disruption to the brain. This may mean a blocked artery, also known as stroke, a hemorrhage in the brain, or abnormal aging of blood vessels. Just like Alzheimer's, vascular dementia risk factors revolve around advanced age, family history of similar diagnoses, and heart disease such as atherosclerosis and high cholesterol. Now let's go back to some of the language problems people with dementia may encounter. Along with having trouble remembering names for specific objects or places, dementia patients may also mix up words or jumble up sentences. New vocabulary may lead to confusion, inability to communicate, and overall frustration. So, for example, instead of saying wristwatch, people with dementia might call it a hand clock. Number 4. Disorientation. Imagine your favorite TV series has just been released and you've spent your entire day binge-watching it. By the end of the series, you'll realize how fast time has passed, and the entire day has passed you by. Now imagine being unable to understand the time of the day, being disoriented by where you are or where you came from. One of the early signs of dementia is disorientation and confusion about time and place. We are not talking about a few minutes or even a few hours. People with dementia lose track of time spanning over days, weeks, months, and even years. Occasions that occurred 5 years ago become yesterday's events. Along with problems with the passage of time, dementia patients may also experience disorientation as to place and whereabouts. A family member's home may appear strange, and a familiar neighborhood may seem like a different city. Some even have trouble expressing where they are at a specific moment. While this type of disorientation may occur later as the dementia progresses, the first sign is usually forgetting the day of the week or one's home address. Number 5. Personality change. As dementia stems from brain damage, this condition may manifest differently depending on where exactly in the brain the injury has occurred. For example, if we are talking about frontotemporal dementia, then the most common symptom is personality change. This uncommon type of dementia is mostly inherited and is a result of abnormal protein aggregation that causes brain pathology and damage. Unlike Alzheimer's and vascular dementia, frontotemporal dementia is associated with an earlier onset age. As the frontal lobe of the brain is responsible for personality and behavior, the frontotemporal dementia manifests as personality change and abnormal reactions. Even though we have all experienced sadness, irritation, or annoyance at some point, people with dementia experience personality change on another level. Rapid mood swings, confusion, lack of self-awareness, and sudden impulsiveness are just some of the new personality traits one might demonstrate. Along with high and low emotions, people with dementia may show signs of odd behavior, such as neglecting personal hygiene, loss of motivation, and apparent rudeness towards others around them. Number 6, poor judgment. When we are faced with new challenges, most of us may have trouble making decisions. This may be due to anxiety or fear of failure. For people with dementia, poor judgment is demonstrated with inappropriate actions and decisions. As an early sign of dementia, poor judgment may manifest as wearing inappropriate clothes for a specific season or weather. So instead of going out with warm gloves and a jacket in the winter, dementia patients may only wear a t-shirt and shorts. Other examples are having difficulty dealing with money or forgetting daily grooming routines, such as brushing their teeth or showering. When dementia is expressed with poor judgment, support from family and friends may play an important role. By dropping little reminders or having honest conversations, dementia patients may have a better understanding of their recent actions and behavior. Number 7, movement changes. Did you know dementia may also cause movement changes and motor control difficulty? Lewy body dementia is another type of progressive dementia that damages specific regions of the brain. Abnormal protein buildup and cell-to-cell communication disruptions are the common causes of Lewy body dementia, or simply LBD. Similar to Alzheimer's disease, LBD occurs over the age of 60 and is associated with family history. But what makes LBD unique in its involvement with motor and cognitive function changes? Early dementia signs of LBD may appear as slowed movement, trouble swallowing, or tremors with walking. As the disorder progresses, patients may also experience sudden falling and restlessness. These kinds of motor changes are what are called voluntary motor changes. But along with voluntary movement, LBD can also affect the autonomic nervous system. So blood pressure, pulse, digestive systems, and urinary control may all experience mysterious changes. Number 8, hallucinations. While we are on the topic of Lewy body dementia, let's also discuss a very unique yet uncommon early symptom of dementia that may arise. People with LBD may experience visual, auditory, olfactory, and tactile hallucinations. Visual hallucinations can be expressed as unusual shapes, mysterious creatures, or people showing up out of nowhere. Auditory hallucinations can be anything from high-toned sharp noises to familiar voices of family members or friends. Another kind of hallucination Lewy body dementia may display is smell or olfactory hallucination. This means that patients may smell certain foods, smoke, or foul smells that may come and go. LBD may also cause touch or tactile hallucinations. This may manifest as crawling sensations on the skin or internal organs moving around in the body. Number 9, withdrawal from family and work. And last but not least, let's talk about how most types of dementia may result in noticeable withdrawal from everyday lifestyles and routines. As most adults have responsibilities such as work or studies, many may not have enough time to hang out with friends or have family dinners on a regular basis. For patients with dementia, even responsibilities become neglected as massive withdrawal takes place. The earlier signs of withdrawal can be described as the inability to start or hold a conversation. Dementia patients may become confused in conversations and have trouble communicating their thoughts and feelings. This may transition into withdrawal from everyday hobbies, routines, or social activities. Going out with coworkers or friends may seem like difficult challenges to complete, but along with withdrawal from social engagements, people with dementia can also have disturbances at work or their occupation. As social gatherings and professional careers make up a large chunk of people's lives, withdrawal from everyday activities become apparent early on in dementia patients. Were you familiar with these early signs and symptoms of dementia? Do you have a better understanding of what dementia is and its characteristic symptoms? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.